everyone. I am so amazed to see actually my teacher. You will not believe it, but like 5 years ago, I took a Dr. Mikryukov class about laser removal of tattoo. And that was the most intense advanced class because he's having the whole medical degree, been in the laser industry for about 20 years, if I correct. Maybe like
15,
even more.
15 years.
Yeah, I feel
15
like
years.
15 years. Okay. So he was working with the lasers when they just started, like I know he saw all of the progressions of what's going on right now in the industry. He talked a lot about removers, because that's kind of like unregulated in our industry. People don't know what to do, how to do correct removers. So I know he have like a lot of amazing information. So I cannot wait to dig in. So hi. You can say
Hi,
more
thank you.
about yourself, about your
Yes,
career. I will be happy.
hi everyone, and I'm really appreciate to visit such podcast, and record this video. Thank you very much, and I'm ready to answer all your questions for your audience and tell everything that I know about this topic.
Yeah, so tell us a little bit about yourself. Like, how did you start it? Like, so people get to know you.
Okay, my name is Vitaly Mikryukov. I'm 40 years old, and I am a medical doctor. I'm first specialty is a surgeon, and the last one is a laser cosmetologist. I'm a PhD in medicine, and I passed the road from the very beginner in cosmetology, specialist in cosmetology, to the owner of my own medical center and my own medical business in such field.
Amazing. So let's dig into removers, lasers, and like a correction. I feel like a correction also, like it's a huge topic. I actually would love to start with that if you okay. I know I remember in your course, you even showed the pictures.
Yes.
The way when we do correction, it's not like we're doing it layer by layer. It doesn't mix inside, so what's your approach on like what's best? Because in US right now we're doing a lot of correction with just the orange or red pigment, and how is that going to affect the skin in the long term and everything?
Okay, thank you. It's a very good question, and I'm strongly against of color correction and adding yellow or orange inks to correct the bluish tint of the eyebrows, which appear with the time, and because this is not so good idea, because when you mix the old one pigment in the skin, it's carbon black, it's very stable in the skin, and usually it's the main cause of this bluish tint. You add organic pigments, because orange and the yellow pigments, it's not usually, it's all of them is organic pigments, and these pigments are not so stable on ultraviolet radiation, and when the time will pass, 6 months, 9 months, 1 year, the amount of pigment particles of orange and yellow color will decrease, and you will again get the bluish tint, the grayish tint, the cold tint of the eyebrows, and you will need additionally another one time make color correction, and you will do this every time, every 6-9 months, and in one particular time, you will understand that it's better to remove old carbon black particles and make the new one permanent makeup. And in that case, it will be pretty difficult, because you are put inside a lot of yellow and orange pigment, and that's why you will get the orange residue or yellow residue on the eyebrows, and almost no one laser is can't remove it. Sorry, I'm not native English speaker, please.
Sorry, I totally get you. So you share a lot of valuable information, so that's
yeah. Yes, because if you put it a lot of such pigment particles, you will get bad residue, orange residue. You cannot remove it with any laser, and you will need to wait maybe 1 or 2 years to it natural degradation under ultraviolet radiation, or use chemical removes. Both of these ways is not so good. It's the best solution is not put this organic orange, yellow pigment particles inside, and previously remove all carbon black, because carbon black is the best pigment for laser removal. It can be removed easily with a laser, and it make your work and make your future permanent makeup much more easier when you remove old residue and not put a lot of new inks to correct this color, because it will looks not so good with time. You will understand that it's better to remove. It's always in this way, going in this way.
Yes, that's amazing perspective of because a lot of people just don't understand. And I feel like being a permanent makeup artist, we need to look for longer terms of like what's going to happen with our clients. We're like responsible if we want to stay and being in the industry for a long term. We're responsible from our clients from the day one to like 5 years, what's going to happen. So the clients trust you. They have no idea. Should you put the orange? Should you correct it? Or should you do laser? Or what do you do? And I think in our cases, a lot of people just afraid to tell them because it's like, oh, it's my work. How can I tell them to go and do laser removal? Oh, like, so like, I feel like it's a fear of the artist to explain why it's good or not. So how would you recommend to approach?
Yes, it's very easy to explain. You don't need to afraid of such explanation, because you can explain that to make the better work, to make a good work in new style, maybe in modern style of permanent makeup, like powder brows or something light, you need to remove old one. It will make the procedure easier and the result will be much more better. You don't need to afraid of this, and usually if you don't have not so saturated eyebrows from previous procedure, you can cope with this maybe in one procedure. One procedure of laser removal, it will be enough. After this procedure, you need to wait 2 to 3 months to get the final result of fading, and after this you can provide a new procedure of permanent makeup and apply your new work with a good quality.
I think that's the most what I get from the clients, and like, oh, I have to go for 2 months with no brows? That's like the most concern of the clients all the time. But I think it depends on how you explain them. That's the thing, right?
Yes. It's need to immune system to make the cleaning of the skin of the old pigment particles. On this period, your client can use usual makeup, draw her eyebrows with cosmetic pencils, and it's okay. It's normal. It's better than to put the organic pigments correctors and make the worse and worse and worse with every procedure. And it's 2-3 months pass very fast. It's really very fast time.
I like that we're getting into that topic, actually, like organic and non-organic pigments. So what's your approach on like what's best right now? I know like organic, as you mentioned, carbon black, it's easy to remove with a laser, but also right now in our industry, it's like, should you use organic or should you use a mineral or should you use like the hybrid? What's like the best? And I know like it's all depends on the technique and the application, but what's your thinking about like using organic versus minerals or hybrids, pigments and stuff like that?
Okay, thank you. That's a very interesting question. And first of all, I want to say that it's not so simple thing to divide pigments to inorganic and organic. It's much more better to understand that every pigment has its own properties, and you cannot make such simple division, because in inorganic pigments you have iron oxides, you have carbon black, you have titanium dioxide and other not so usually used pigments, but you have all of them have a different behavior in the skin and a different behavior in the process of laser removal. The same thing with organic pigments. Okay, you will have maybe red organic pigments, but there are some research that show that different organic pigments absorb a different portion of laser wavelengths, and you can get one organic pigment that will be destroyed by laser very easily, and it's in a very easy way, but some of them will be very resistant. And both of them is red organic pigments, and they have very different behavior during the laser removal. That's why you can't so easily divided organic and organic. Organic is good or bad, or inorganic is good or bad. No, every single ink, it's a mixture of pigments usually, and usually it contain inorganic, both inorganic and organic.
Like a hybrid.
Yes, because the black and white colors, which I used in getting the ink color for eyebrows, for lips, usually it's carbon black, it's inorganic. I insist, it's inorganic pigment.
Inorganic,
and yes, and
yeah, because it
titanium
starts
dioxide.
with 7.7. Technically, it's considered to be inorganic.
Yes. I say I make such put your attention on this because there are so much myth that carbon black is organic and different forms. It's inorganic. It's scientifically proved. It's don't need to be proved. It's inorganic pigment.
Okay.
And that's why
I love it.
Every ink is a hybrid. It's contain both inorganic and organic.
So I guess the myth that going in our industry is like, you know, carbon black, it's staying in the skin, so that's why they say like it's act as organic because it stay longer, and because of the smaller particles, it's just like it's almost never like literally get out of the skin. So technically, when we say permanent makeup lasts like up to 2 years, you're still gonna have like a gray residue from the carbon black, depending how you know, depending on the implementation. Because I see a lot of people go with the organic pigment. Not going to say the brand, but all coming from very well-known manufacturer, like world famous, you know, all of us use carbon black in the production. And a lot of like in US, we use a lot of people use a technique where they go with a line on the bottom and line on the top. And especially when you're inner, you know, your line become very thick because you still use thicker pressure. So to build up that color and the residue and the saturation of the brows, you go a lot. And that's what, and a lot of times cause that gray turn into the blue with the time, right? So, so in this case, if you're going to add the orange, going back to our conversation, that's only going to do, it's impossible later to remove, right? But what do you say? So the person just have to find somebody who doing a laser removal for the brows, right? What your recommendation, like what kind of laser it should be, you know, if they don't work with the lasers, because it's a lot of things going on right now in the laser industry. I saw scars, like doctor's removal. I have a proof of the picture of a girl who came to me, she my student, and she have a whole sleeve removed from a dermatologist office. And it was a 2nd-degree burn with the blisters. And I was looking at her after your course. I know that shouldn't be a blisters because it's a 2nd-degree burn. And if she's going to go many times, then it's going to be a scar tissue, you know? So like, how will you like recommend to look for a laser or like find somebody like some professional or?
Yes, it's not so easy. It's not so simple question because from the laser depend the quality and the speed of fading. It's like a result of fading of tattoo pigment, but the safeness and effectiveness of the procedure depends from the specialist. Even if someone have a small compact, maybe Chinese laser, but have a good skills, good knowledge, deep knowledge in this field, he can cope with a lot of cases. He can solve this problem for client and make it in safe mode. But if a person have no deep knowledge, don't understand what to do, the most expensive laser will be very dangerous in such hands, and it can provoke a lot of complications and suffering for the client. And really, I don't know how to answer this question. It's you need to look how this specialist work, how the skin reacts, how the heal result. There is no scars. It's need to be there are no scars, no blood, no crusts, no injury to the skin, because
right after the treatment.
The normal reaction for the laser removal is only inflammation, is swelling, redness, some little pain on the skin, but it passes very fast, especially on the permanent makeup eyebrows. It really finish after a few hours, maybe 1 day maximum, but there are no some you need no ointment, no bandages, no something like this. It's only swelling. That's all. This is show that there is no skin trauma, no big skin trauma.
Mm-hmm. So, for example, if somebody in our industry in a permanent makeup and in their state they allowed to work with the lasers, do you actually have a core course in English? What they can study?
Yes.
Okay, cool.
Yes,
okay.
we'll
Save the link below, for the course in English. I highly recommend it. If you're in the States and in your state you're allowed to have a laser, highly recommend to know how to do it if you're in the permanent makeup industry, because right now I'm personally predicting that will be the era of the brow removal. Because we done the work, we done the bad work when we was learning, when we didn't know the pigments. Like 10 years ago when I started, there was not much of a knowledge of like different pigments, what's they contain of, what's the speed of a machine, what's the depth of the machine, what's the stroke size of the machine, So it was not like, I remember I worked with the long time liner, but I couldn't order, that's a 4, right? That's a 4 stroke size. It's a very strong machine. So I didn't know nothing about it. They was just telling me like what to push on the buttons, how to do it with their own pigment. And their own pigment was very diluted. So back in the days when I went to another course and they told me you can order a 6 cents pigments. And, I didn't know anything. I was just trusting the teacher. And I didn't dilute any of the 6 cents pigment, and I worked the same technique as I was working with diluted long time liner pigments. And I was like, oh, they just go into the skin like I have my brows done in 2 passes. This is life-changing transformation for me. I was so excited. I didn't know they are organic. I didn't know they concentrated, so, and I worked with the 4 stroke size, like almost tattoo machine, like very strong in the skin. And I was like, why my brows coming to me like months later blue? Because I'm like, I didn't know that
it was oversaturated.
So I highly recommend, if you have a possibility of buying a laser and work in your state legally, or working with a medical advisor who can work and who you can work under, because right now I feel like a lot of people have a brows, and a lot of people, especially in America, have a bad brows with a dark, darker look, grayer, bluish, greenish hue. And I feel like right now we will need to do some rehabilitation of that bad work what we done back in the day.
Yeah, it's one of the reasons there are some students come to my course, because they know that their old works will come to them and they need to do something with such clients and make somehow help them and make the new work, because without the laser removal it's almost impossible. And I want to say that I'm specialized on laser removal, and there are a big difference between the specialization and the doctor. The doctors are really good persons, but if they do not specialize in this topic, it's a very big problem, because they think they know what they do, but there are so much small things that make the influence for the result, for the safeness. And I'm in this field really 15 years, and 7 years I'm like a teacher, I'm trainer in this field, and I see a lot of cases, and it's really important to know everything in this field, to know and I can teach from the zero, from the minus to the specialist in this field. Yes.
I remember when I took your course, one of the things what I was very surprised, because again, I took it long time ago. I'm sure that your knowledge there, now it's even crazier, but one of the things what I remember you were saying, back in the days when you worked with a laser, was a scraping laser or something, and that you discovered that tattoo color stayed black. It's just the way we're seeing it under the skin. The deeper it's go through the years, it's changing color to the blue, and you visualize that and show it to the showcases of it's actually that color, it's still black. And I think people don't that was creating a lot of changing in my head, why carbon black act and then showed itself differently with the time, because the depth of the pigments just going down with the time, especially if we applied it incorrectly, and then the upper layer of the skin.
It's Tyndall effect. Tyndall effect, it's optical properties of the skin. It's the skin is not transparent, and it's when the light go through the skin, the parts of wavelengths, usually it's short wavelengths, it's bluish color, reflects from the skin, from the layers of the skin, and go right in our eyes, and we see like bluish lightning or bluish tint. In reality, it's only a reflection of short wavelengths of the light, and it's really I have in my account the demonstration when the tattoo on the palm, and one part of the epidermis, it's very thick epidermis here, it's cut it out, and you see the difference in color. The almost all tattoo is bluish, and when there are where the injury of epidermis, you can see the black pigment. But this is same tattoo, and this explain how it works. And in the eyebrows the same. The old eyebrows really look like bluish tint, or if you put the pigment very deeply on your procedure, you will see the bluish tint.
It is safe to use a laser on like Fitzpatrick 5 and 6, or it is some kind of contraindication because of the hyperpigmentation?
It's a contraindication for using the 532 nanometer wavelengths. This wavelengths is used for brown color, for red color, and it's really contraindication. And if you use 1064 nanometer for black color, some authors recommend for the 4, 5, and 6 type of skin Fitzpatrick scale, reduce the fluence, reduce the energy of laser to prevent some complications. And if you have possibility, I can show. I prepare some illustrations. Maybe it will be interesting to the subscribers.
I can give you shares of the screen, so you can technically take a control and show your screen as well.
Okay, I can show the why it is contraindication, why it is can be a really big problem, because I have some cases to show. I show such. Sorry. Okay. Yeah. It's like this.
Yeah.
You see, it's not so,
microblading.
Yes, it's maybe for skin type 4.
They look like 4.
And there is the procedure. Sorry, I need to. 1 second. And here you can see. I'm sorry, I have some technical issue. I think it's edited. Okay. And here is this part was need to remove. Yes, and the specialist used 532 nanometer. Even here you can see the spots. You see, it's like spots. I don't know why they shoot on the skin around. Maybe
I'm like, what was there?
Do not control it. Maybe make the mistakes, make some shots around. But look what happened next. You see the melanin.
That's the same person.
Yes. It's like dynamic of this case, and this is after a few days. And here you can see, and the final result after the healing, you can see the depigmentation of all this area. And this is what can happen when you use a 532 nanometer wavelength on the dark-skinned patients. So, and this pigmentation can resolve by itself for 2 or 3 months, but it can stay for 1-2 years, and there is no some procedures to make it the back and make the normal pigmentation. That's why there are some restriction to using 532 nanometer wavelengths on this.
It looked like a melanin just doesn't produce in that spots anymore, like.
Yes, it's true, because melanin is absorbed 532 nanometer very well, and if the skin is saturated by melanin, you will have a lot of trauma, injury, and such result like this pigmentation of the skin. I can close it. I have a lot of very interesting.
I love that. I love that. Yeah. So
really, it's
much you say like
when I say it's restricted. people don't understand why. And when you show this, what can happen? They start to think, I understand why it's restricted. I understand what can happen. It's very helpful for understanding.
Yeah, for me, like I worked with hair removal back in the days under the doctor. So even I remember that was my first day at work. Awful story. It was we did the LP removal of the vessels, like the blood vessels with the IPL. So her black hair just get into the gel, and I didn't see that little black hair, because I didn't know that it will really affect. And she has like a little blister. I was freaked out. Glad I worked under the doctor. Doctor solved the issue, like kind of like explain everything, that everything was fine. But she was not melanin at all. Like that, she was like Fitzpatrick max, but that just like little black hair with a laser create a little blister, in the high settings.
Thermal burn, because the melanin of the black hair is absorb the energy and heat it.
And then it was hit the energy hit so hard. Yeah, but I was just being freaked out. I was like, I was freaked out. Like I was like, it just literally was my first month working as an esthetician under the doctor with a laser. So I was like, oh my goodness, I'm like, never again. But it's just like I know that the melanin skin, it's a little more harder, and like you have to be more caution and dependent on the laser as well. Like if they be able to work on the does it any particular length waves what you can work with the melanin skin? You mentioned it. I just want to like.
It's you can almost easily work with 1064 nanometer because it's infrared. You can use the wavelengths of 1064 nanometer because it's infrared and it's not so good absorbed by melanin. You can use it without any strong restrictions, but all shorter wavelengths like 755, 532 nanometer, it's really a good absorber. It's visual range, and the melanin absorbs these wavelengths very, very well. And that's why it's maybe can become overheated and make the complications like blisters, like burns. And you really need to be very accurate. Yes, very accurate.
Careful with
yes. I can't talk in English so much time because I start to be tired and I start to miss the words.
You're doing so amazing.
I'm trying to do my best.
Yeah, like you're doing so amazing. Especially you talk in the medical terms, which is also like a harder. So will you recommend for like somebody who's a Fitzpatrick 3, 4, 5, or like 3 it's fine, right? 4, 5, 6, to go through remover process? I know we talk a little bit about the remover, like you have opinion. I want to really hear that.
Yes, in reality, I don't like chemical removals very much because it's very traumatic procedure, and you can't use chemical removal without trauma of the skin. This because the mechanism of its action depends from the trauma, from the inflammation, and you need to create trauma to the skin to get some fading of the pigment. There is no other way. You need to use your needle, your permanent makeup machine, and use some chemical aggressive liquids like maybe acids or alkalis, and you need to make trauma but not to make complications. It's very, very hard goal. Yes, it's very thin line, red line, because yes, because if you not take into account all factors like an age, type of skin, regeneration abilities of the skin, maybe bad habits like smoking, and maybe some contraindications like diseases like diabetes, and all of these, you not take into account all factors, you can make the wrong decision and yes, create very big problems. That's why it's much more, to my point of view, it's much more dangerous method to remove, and it's really much more risky than the laser, because laser you can provide these procedures without any skin trauma. You do not make open wounds, you do not make open injuries. It's much more easier to control, if you understand what you do. And
Yeah, because
well,
as I mentioned, some people burn people's skin with a laser and
yes,
create
and
trauma.
you need to know that the dark-skinned patient have the more chances to scar formation. Yes, they have more chances to get the scars like keloid
I'm curious.
scars, and it's more probably on the dark skin types than the light skin types. It's genetically and it's statistically proved. That's why it's not the gold solution to use the chemical removal, but you have no other option. You need to make it accurate.
Okay, so we finished about like removers, and the lasers, what's better, what's safe. So I know you more into lasers are safe, but I know people still will sometimes use a remover, so send clients to removers. And the question will be, what's the best remover? I know people will ask, like it is any
Yeah.
better remover than the other one, or it's all about technique.
Yeah, it's a good question because you need to person who try to work with remover need to understand that the different removers have the different mechanisms of action. In simple way, I can explain like acid removers, saline removers, and alkaline removers. All of them have the different action to the skin, and you can remove successfully with all of these types of removers. But you need to understand that the difference in aggressiveness to the skin, and according to this, you need to use the right techniques and make less or more trauma and control the trauma of the skin and inflammation on the skin. But I have advice for masters who try to work with removers that you can scale the removers in aggressiveness like this. The most aggressive removers is alkaline one. It's the most dangerous one, and if you don't have any experience with the skin, with the controlling of the trauma, with removers, please do not start from the alkaline removers, because they have mechanism of action like liquefying of the skin, and it's very hard to control the level of trauma and prevent the complications. It's most dangerous one. The next one is acid removers. It's more controllable because you can understand the aggressiveness of the acid removers by checking the pH level, and the lower pH level of remover means that this remover is more aggressive to the skin. Like this, if the pH, it's a chemical indicator, pH of the acid remover is like 4.5, 5, it's mild aggressiveness. It's not so aggressive. It will not add a lot of trauma. But if the chemical remover have the pH like 1 or 2, indicates, you need to understand that this is very aggressive, and the difference between both of them is acid removers, but they in comparison with each other will differ in 2 times of aggressiveness. That's why you need to know the pH level of acid remover, and you need to, if you have aggressive remover like with pH like 1 or 2, you need to use the neutralizer to prevent the excessive trauma to the skin. But if you don't have any experience and you only start and want to try to remove, please use saline removers, because it's most safe. It's not so maybe effective like you can think about them, you can wait from them, but it's more the safest way, because they don't have chemical aggression at all, and all removal effect, it's from the mechanical trauma, from the needle. And you need to know that if you use the clear needle without any aggressive liquid, you will get the fading of the permanent makeup only from mechanical trauma. I think nobody know about this, but clear needle without any aggressive removal, you can get the fading. of the permanent makeup, and maybe in some cases it will be enough to get the result, but you will have very low risks. Please be very aware of the removal. It's not the magic liquid. It's not the some fairy liquid that make all for you. No, it's you make trauma and you need to control this trauma, and this is the mechanism of direction. That's why you can't find the best remover. You need to choose those one that you can control and that you understand what you will get, what level of trauma you will get, and you know that you can control it. That's why it's you can use all of them, but if you understand what result you will get in the particular case.
Yeah, that's actually amazing explanation, and I like how you describe it of like level 1 to the level 3 of danger. So saline for beginners, if you don't understand how it works, like the second one. I think a lot of people don't understand the pH balance in general. Like I find that in lash industry, we use like a primers and a lot of stuff. It's also based on pH balance. So people can tell you it is a primer or bonder, but basically they are the same pH balance. So ingredients, it's almost the same. So if there's the same pH balance, it doesn't matter if it's this product or this product. It's just gonna work as speeded up the glue, for example, right? So the same thing here. I feel like if that's gonna be a lower acidic, then that's mean this and this and that, right? Because our skin, it's 5. pH balance of the skin, it's 5. I know the lashes,
5.5.
So
yes, 5.5.
Skin. So like when you work with 5, it's a less aggressive because it's similar to pH balance of your skin. If it's lower, that's aggressive. It's kind of as a chemical peel on the skin, like seems like it's similar.
I was very surprised that a lot of permanent makeup artists and masters do not know the type of remover they use and do not know the pH level of the remover they used. I don't understand such a situation. Why you use some liquid without any knowledge about what inside of the bottle and what the effects you need to wait from the skin and what you will do with this. But a lot of them do not know.
Yeah, so I'm great you talked about it. If you guys don't know your pH balance of your remover, and if you're working with the remover, just go Amazon, buy pH balance strip, and actually find out what are you doing on the skin and how dangerous it is, like your remover, and how strong is your remover. So that's going to help you out to understand like what to do, how to do it, be less, less aggressive when you implementing the needles as well. So I'm so grateful we covered a lot of different topics. I'm going to link below your course. We'll just need your link for the courses, because I'm sure a lot of people can get tons of information. I know your knowledge is very in-depth and deep. It's not like just a superficial, also because you are a doctor, so you understand how the skin work, because I like when you was talking about like just using a clear needle, and I'm like, that's totally makes sense, because all what you do is you activating immune system. So the immune system get to that place where the our pigment was, and the immune system will start working to removing this pigment because it just completely forgot it's there. Because sometimes it's like I know that the like the molecule of the pigment can grow on top like a little extra skin kind of.
Like that's inside of macrophages cells, and when you make the trauma, you provoke the inflammation. Inflammation provoke the cells of macrophages. You disturb the pigment, and it's become more available for immune system, and all of that works in complex, and you will get the results. Of course, it will be not so prominent. Maybe you cannot remove totally by the one procedure, but you will have some fading, and maybe sometimes it will be enough for client.
Yeah, because I like that's that's a great topic. It's just that topic can help you a lot in the industry. Just I feel like because we don't understand what's really happening in the brows, or in the lips. Like the reason why sometimes the pigment stop fading, it's just because of that microfiber what's going in the top of the pigment, and your immune system just don't know that it's there anymore and stop trying to take it out of the body, stopping to get it out of the lymphatic system, and then if you're just activating it, that can cause that was a great tip. I personally think so. And I think that people can benefit just that. Yeah, so I'm so grateful that you be able to
Thank
spend that time, share your amazing knowledge with us. If you have any questions, guys, you can always like DM me or just comment below. And then if you have a lot of kind of good questions, we can go back and like just have another
Yes,
podcast with the
of
amazing
course.
doctor. So follow his Instagram.
Yes.
I'm also gonna link it below because he share a lot of information in English. He have like huge follower in Russian podcast, like in the Russian Instagram, and now he doing it in English. So I'm really, really grateful because we do need a good knowledge, not just like somebody say so, but actually it's scientific proved, not just like a fiction. So thank you so much for being here with us.
Thank you.
Really,
Thank
really
you. Thank you.
appreciate
I'm
it.
really appreciate for invitation for this talk, for this podcast. And really, if your subscribers have a lot of questions, I'm ready and will be happy to answer to all of them and help them to understand all of these topics deeply. Okay. Thank you very
Thank you
much.
so much. Thank
Nice
you.
to
Have
see
a good
you.
day.